Hello viewers, thank you so much for joining me on this channel. In today's video, I'll talk about explanation. Explanation is one of the most important aspects of working as a doctor. Often we have to explain a diagnosis to a patient or sometimes a plan of treatment to a patient. This is also frequently assessed during MRCS ENT OSCE. One of the most important communication skills station is giving explanation. We are expected to explain a diagnosis or a plan of treatment to a patient in the stipulated 7 minutes time. Also, in view of the new regulations in MBBS students can also expect to encounter giving explanation as an AETCOM station during their MBBS exams. So let's get into it. The most important thing to remember while giving explanation to anyone is you should give information in small chunks and you should always check if the person is understanding you or not. If you remember this much, I think you'll be able to do justice to the task of giving explanation. Giving explanation does have a logical sequence. You should start by introducing yourself, mentioning your designation, and then confirm the identity of the patient while asking how they prefer to be addressed as. Before you discuss the details of the task, you should understand what the patient already knows about their condition. While explaining, you should try to avoid medical jargon as much as possible. Information should be provided in small chunks, and after providing each new piece of information, pause and check for understanding. It is a good idea to tell the patient that they can interrupt you at any time to ask any question, and you'll be happy to answer every question that the patient asks. At the end of the entire discussion, summarize the discussion, tell the patient how they can get in touch with you for follow-up visits. It is a good idea to provide leaflets. If during the exam, especially in MRCS ENT OSCE, you are provided with visual aids like charts or models, it is a good idea to use them while you are explaining a diagnosis or a plan of treatment to the patient. At the end of the entire discussion, please don't forget to thank the patient within the stipulated 7 minutes time, especially in MRCS ENT OSCE. I feel if you follow the MRCS ENT OSCE preparation strategy even for your MBBS AETCOM stations, you are most likely to do well in MBBS exams as well. In view of the new regulations introduced by National Medical Council, AETCOM, also known as Attitude, Ethics and Communication, is a very important aspect of assessment of MBBS students in India. I feel if you try to follow this strategy in your AETCOM assessment stations, this would also benefit MBBS students. Let's discuss this with the help of a question. In this question, we see a 40-year-old man who has rhinosporidiosis in left nasal cavity. He wants to know what are the treatment options. Your task is to explain the plan of management. If this were a question in MRCS ENT OSCE, I would approach it as follows. I would have 7 minutes time and so I would request viewers to time me. Let's start. Hello, I am Dr. Puspen Dasgupta. I am one of the ENT doctors working in this hospital. Is it okay if I talk to you for some time? Could you please tell me your name and date of birth? How may I address you, sir? Thank you, Tom. So Tom, before we discuss further, could you tell me what you already know about your condition? Thank you for telling me that, Tom. So I understand that you already know that you have a disease in the left side of your nose and it requires surgery. Can I tell you more about the disease? So Tom, the disease that you have is called rhinosporidiosis. Earlier it was believed to be caused by a fungal infection, but in view of recent research, now it is believed it is caused by some other microorganism. The key thing to understand here is the only way to treat this condition is by performing a surgery. Do you have any questions for me? At any stage, if you have any questions, please feel free to interrupt me and ask me those questions. I'll be happy to answer all of your questions. Is that okay? So as I was saying, Tom, rhinosporidiosis can only be treated with the help of a surgery. There is no medical treatment of this condition. Can I tell you more about the surgery? This surgery is performed under general anesthesia. You'll be completely asleep during the procedure. If you have any questions related to general anesthesia, our anesthesia doctor will be happy to answer them. You'll have to fast for a few hours before the surgery and for a few hours after the surgery. The exact duration of fasting will be intimated to you once you are admitted. Do you have any questions for me? This surgery is performed without making any cuts on the skin. We have a look inside the nose with the help of an instrument called telescope, and we will remove only that part of your nose which is diseased. Following the surgery, we will introduce dressing material in your left nasal cavity to prevent bleeding from happening. Do you have any questions for me? This dressing material will stay inside your nose for about 24 hours, during which you will feel a sensation of blocked sensation in your left nasal cavity. However, this will go away once we remove the dressing material 24 hours after the procedure. So you'll have to spend the night in the hospital. Do you have any questions for me? The benefits that we aim to provide by performing this surgery is the complaints that you're having regarding bleeding, they will go away following this surgery. We'll also be able to confirm our diagnosis by having a look under the microscope at the tissue that we remove following the surgery. Can I tell you about some of the risks associated with this surgery? Do you have any questions for me? Thank you, Tom. So, as I was saying, this surgery is associated with a very common risk of bleeding following the surgery. However, we will take all the necessary precautions to prevent bleeding from happening, and even if bleeding does occur, it is usually not serious, but we will take all the necessary precautions to stop the bleeding as soon as possible. One of the most notorious complications of this surgery is that this disease tends to come back, but we will perform the surgery in a manner to minimize the chance of this disease coming back in your case. However, we cannot guarantee that, Tom. I understand it is a concern for you, but we will take all the necessary precautions so that the disease does not come back in your case. However, it has been noted that it does come back in many cases. We will try our best, Tom. Coming to some rarer complications of this surgery, in about 1 in 500 cases, complaints related to eye have been noticed following this surgery because the eye lies quite close to the nose. It is separated by a thin layer of bone. If there is injury to this bone, there can be swelling around the eye or bruising around the eye. Bruising around the eye goes away on its own. If there is swelling around the eye, it can lead to double vision, and in some very rare cases, it can also lead to loss of vision in one eye. However, we will take all the necessary precautions to prevent this from happening. We have a competent team of surgeons here, and these complications, we will try everything possible to avoid these complications from happening. Do you have any questions for me? Another even more rare complication of this surgery is, as you know, the nose is separated from the brain by another thin layer of bone. If this layer of bone gets damaged, the fluid surrounding the brain can begin to leak from our nose. This is a very rare complication, and we will take all the possible precautions to prevent this from happening. Do you have any questions for me? Thank you, Tom. Thank you for being so patient. As mentioned earlier, there is no medical alternative to surgery here. The only way to treat this condition is by performing a surgery. However, there are some precautions that you need to observe following the surgery. Can I tell you about them? You should take about 2 weeks leave from work, and you should avoid strenuous activity for 2 weeks following the surgery. You should avoid blowing your nose for at least 1 week following the surgery. If you have to sneeze, please sneeze with your mouth open. We will teach you how to clean your nose appropriately with a solution. Please do so according to the prescription that we will provide you. Do you have any questions for me? So just to summarize, I've told you about the disease, I've told you about the surgery, the steps of the surgery, the benefits, the risks and the alternatives, and the precaution that you need to take following the surgery. Do you have any questions for me? Here is a leaflet which explains the disease further, and the contact details of our clinic are mentioned on this leaflet. Please feel free to get in touch with us whenever you want to. We will be happy to answer all of your queries. Thank you so much for your time, and I hope you recover very soon. So this is how I would approach this station if I encountered this question in MRCS ENT OSCE. While this question may not be that common in MRCS ENT OSCE because rhinosporidiosis is not commonly seen in the United Kingdom, this is a very common question from MBBS point of view in India. So this was just a broad explanation of how to approach explanation station. I hope I was able to explain explanation properly. In case you have any questions, please feel free to comment and ask me any questions. I'll be happy to answer your questions in the comment section below. Thank you so much for watching this video. I hope it proved to be worthwhile. Take care, and I hope I'll get to see you in the next video very, very soon. Bye bye.